Hello, I am Dr. Sudheendra Udbalker. I am a dermatologist. I consult at Raga Skincare, JP Nagar 7th Phase and Fortis Hospital, Banakatta Road. Managing honeybee bites would basically, about identifying how severe is the bite, how many bites have there been, are there several bites, or there are one or few bites, or there are one or two bites, and it also depends on whether the person is allergic to some of these bites. Less than 1%, about 0.8 to 1% of people can sometimes be severely allergic to bites, where they can present with a anaphylactic shock kind of a condition in response to even few honeybee bites. Those who are emergency situations where the person needs to be rushed to a hospital, as and then managed accordingly in an emergency. Few bites, if the person is not severely allergic, they can develop some nausea, vomiting, and sometimes even giddiness and all those kind of a thing. Those would require use of some antihistamines. Sometimes that again has to go to the hospital. If there are few bites, like one isolated bite, one or two isolated bites, the first thing to do when someone has a honeybee bite is to remove the stinger, because most of the time these stingers also have a venom sac associated with it, which will be releasing this the venom continuously. So most important thing is to clean the wound, remove the tease out this sting, then treat it with some cold packs, because they can be painful. Some ice packs can help in relieving the pain, and sometimes we give some antibiotic cream with a mild hydrocortisone in it, so just soothen that area. But it all depends. Just one or two bites, if you're not feeling very uncomfortable, nothing much needs to be done. You just need to clean the area, remove the sting, and apply some of this cream. Yes, there can be a little persistent swelling which can last for next few days post a honeybee bite, because the body is reacting to whatever venom was locally deposited in the tissues. So that usually results in 3 to 5 days period. So there's nothing to worry if there's a little redness, swelling around the bite area. But if the swelling is more and the pain is more and there's a lot of redness and there is increased temperature there, then it might be a secondary infection in that area which needs to be treated accordingly.